Good morning, members. We now have a quorum. Let's get started. Item number 1, information papers issued since the last meeting. The Secretariat did not receive any information papers since the last meeting. There are 2 items to be discussed at the next meeting. The first item will be welfare services under the coronavirus disease 2019 epidemic, and 2, government the long-term planning for child care services, and we welcome comments or views from members as well. Please refer to the list of outstanding items for discussion and list of follow-up actions. The Secretariat review the relevant contents of the list with the administration, and based on the key areas, different items have been consolidated or deleted. Some might be outdated, while others are removed upon consolidation. Members, please take a look at the 2 lists, and if you have any comments or suggestions, please inform the Secretariat on or before the 20th of January. There will be 2 discussion items for next time, as I mentioned. Any other comments from members? Mr. Yu Si Wing. In terms of the list of outstanding items for discussion, I'm happy to see that the Secretariat has been removed items that are redundant or overlap with other panels. For those that overlap with other panels, such as charitable fundraising activities, every year at the Law Reform Commission, they will have an annual report to report the relevant work. But if we wish to follow up on such items, would the AJLS panel follow up accordingly? Or is it up to them to decide whether or not to follow up? We just want to know whether other panels or commissions would follow up on various items. Secretariat, please. Item number 23, charitable fundraising activities. It was discussed at previous years at the panel, and this includes regulation on fundraising activities on the streets. And if members wish to follow up on this, we would follow up. We can continue to follow up at this panel. I was just saying that if we pass this on to the AJLS panel, would they follow up on the issue in a manner we desire? If not, the point would be lost. I would invite the Secretariat to follow up with the AJLS panel to see who would follow up on this action item, or whether we would set up a joint subcommittee. Any other comments from members with regards to the discussion items? If not, we would move on to the agenda proper. We first invite the administration in. We received 2 papers this morning. One is from the Concern on Home Care Services Alliance. the other from the Elderly Services Advocacy League, and they have submitted submissions, and the relevant submissions have been shared with members this morning. So I believe members might need some time to go through these submissions. I welcome the administration. First of all, Mr. Jonathan Ho, Undersecretary for Labour and Welfare, who would walk us through the paper. Thank you. Today, we would walk members through the measures to enhance community and residential care services for the elderly. The policy objective of the government on elderly services is to accord priority to the provision of home care and community care, which are supplemented by residential care, and this would allow elderly persons to age in place. The government has allocated an increasing amount of resources. The estimated recurrent expenditure on elderly services in 2020 to 21 is around 12.3 billion, representing an about 17% increase compared with 2019 to 20. And this is about 60% higher than the 2017 to 18 actual expenditure at the beginning of the current term government. In terms of community care services and the integrated home care services failed cases and enhanced home and community care services are in place. And the government is also providing respite for elderly carers, and this would allow the elderly to age at home. In terms of community care services enhancements, from 2019 to 2021, an extra 5,000 places have been introduced for home care services to bring the total to 13,365. We also entered a new phase of the community care service voucher pilot scheme. And in terms of residential care services, there are 336 residential care homes for the elderly in Hong Kong, providing about 29,000 subsidized bed places. And for the pilot scheme on residential care service voucher for the elderly, more choices could be provided for elderly persons. For the residential care services scheme in Guangdong, services are purchased from 2 LCHEs operated by Hong Kong NGOs in Shenzhen and Zhaoqing to allow or to provide an extra option for elderly people who choose to live in the mainland. In terms of enhancement measures on residential care services, the government would purchase additional EA1 places with a total target of 5,000 additional places under the EBPS. The government is also seeking to increase the short to medium term supply of elderly service facilities. The government allocated $20 billion to purchase premises in private market for the provision of welfare facilities, and in appropriate long-term public housing projects, 5% of the total GFA would be reserved for public housing development. The government is also developing germ technology. In 2018, the government launched a $1 billion Innovation and Technology Fund for application in elderly and rehabilitation care to subsidize eligible elderly and rehab service units to procure or rent and try out technology products. And soft meals can be made through sharing technology, which allows elderly people with swallowing problems to enjoy their food. And from October 2020, the government has provided additional resources for subsidized elderly services units to provide soft meals. Thank you very much. Apart from the Undersecretary, we also have Mr. Tan Tek Yi, Assistant Director Elderly from the Social Welfare Department. The floor is now open for questions. Mr. Michael Tian, Cheng Xiong Tai, Poon Siu Ping, Yu Si Wing, Wilson Au, and Leung Chi Chang. 5 minutes each. Mr. Michael Tian. Thank you. I'm rather disappointed at not seeing the Secretary. He has a great memory and he knows the topic very well. But anyway, I do have some questions. At the policy address briefing, I asked the Secretary about the outreach, doctors and healthcare programs at the HA. Doctors are deployed at residential care homes to attend to the elderly. And many residential homes are yet to receive any services. Last time, the Secretary admitted that resources were short. If we are to ensure that each residential care home would reserve such premises, how much more in allocation is required? The roundtable is about to meet the Financial Secretary, so how much resources are needed in this regard? As for the residential care outreach services, you will have a midterm review. The response of the program has been very positive so far, and they hope it would be made regular. I'd like to know the outcome of your interim review and whether this program can be made regular. NGOs could deploy various therapists to residential care homes. So both NGOs and the HA would provide such services for residential care homes. For the bot place scheme, over 20 years, some 8,000 places were bought. From 2019 to 2024, 5,000 additional places would be introduced, and this is something to applaud. In the first year, there will be 1,700. And how many EA2 places have been converted to EA1 places? For the public, the difference is only between $1,600 and $17,000 per month. But the fact is, a lot of homes are unwilling to convert places from EA2 to EA1 because of the additional requirements. How can you help the residential care homes with EA2 places? Mr. Ho? At the informal policy address briefing, the Secretary talked about the pilot HA scheme. Hopefully we can furnish the relevant information by the next regular meeting. I will be meeting the Financial Secretary soon. So please allow me to help you. That is not a project under the Labor and Welfare Bureau. That is under the HA. Please give me the figure. As for the pilot bot play scheme, I would defer to Mr. Tan Tek Yi. Can you address the question on converting EA2 to EA1, please? We are going to buy 5,000 places, and in the first phase of the 1,700, how many places are converted from EA2 to EA1? They are all new EA1 places. How many EA2 bot places are there in all of Hong Kong? I don't have such figure on hand. 1 year on, for EA2 places that are not converted, what are you going to do with it? Is the average space only 8 square meters? You are not dealing with EA2 places at all. I'm happy to provide the numbers later. As for the conversion of EA2 places, this is something we would examine. So what is the result of such review? You have 1,700 places every year, and they are all EA1 places, but you are not converting any EA2 places to EA1 places. This is the biggest problem in Hong Kong. The per capita space of 8 square meters and having no nurses is unacceptable. Like we said, we will examine the situation and see how it can be enhanced.
We will consider turning EA2 to EA1, we will consider it overall. Now you will review everything, so what's the point of coming to us? They will consider it. The problem has existed for over 10 years. For 5 years, they add 5,000 places. That's not bad. But they didn't say how many EA2 into EA1. They're still reviewing. Mr. Chen, when will you come up with a view? I cannot come to a conclusion here. We have to talk to the industry. We have to make arrangements. Now, there are inherent difficulties that make it difficult to change to 9 square meters. So you have to think of something. The public are willing to change from EA2 to EA1 with $100 more. So we should give priority to that. Can you give us a written response? Can you go back and tell us and come back with a response? And the Undersecretary, now the outreach service, you will have a report next week. Now this is not under the Labor and Welfare Bureau. This is under the Hospital Authority. So they have to supply us with the information. So is it decided by the HA and not with regard to your views? We each have our own approach. We will get the information to inform the panel. So I will ask the Secretariat to take this matter to the Health Services panel. And perhaps we can also write directly to the HA. Okay, we write to the Labor and Welfare Bureau, and we will also ask the Food and Health Care panel to note this. Mr. Chen Xiong-Tai, now I have a relevant issue. Now, given the epidemic, there is a clear direction. We hope the administration can tell us clearly whether they have planned the Wuhan virus or COVID. Now, for the care service for the elderly, there is a need to change our plans, even with vaccines. This doesn't stop the transmission. Right now, for all the vaccines, now the chance of onset is reduced. That's all. So it's like tetanus. So it's not that after vaccination the elderly will not be infected. It's just that the onset rate will be reduced. So whether it's residential care homes, home care, or community care in the next 2 or 3 years, before there is a method to halt the spread of the epidemic, then in the next 2 or 3 years, we need to plan for our care for the elderly. There are 3 issues. Firstly, now we thank the organization for submitting a detailed submission today on residential or on the home care service. Now, there are submissions on training and other services that have been halted temporarily since July. Now, for the elderly, this has a major impact. So for half a year, there is no home care support service. So the physical conditions deteriorate, the elderly. And then community treatment and the service to take elderly to treatment, all these have been halted. Now, some chronic elderly patients have to go to hospitals for repeat consultation, but the hospitals ask them to provide a PCR certification. Now, but the RCHEs will not do that for them. They have to pay $1,000 for that, or they have to go to outpatient clinics and queue up. So the government doesn't support these long-term illness sufferers. So they have to queue up at the outpatient clinics. So it affects not just the elderly and the family members. Now the care workers have to accompany them for queuing, and it takes a lot of time. And then there's a humanitarian issue. Since July last year, all the RCHEs do not accept visitors from family members. So the administration should think of conditions under which family members can visit. It's not half a year, it's 2 years. Now at the RCHEs, now many family members feel that the elderly are being locked up or kept in confinement, so even perhaps until they die. So now these are elderly people in poor physical and mental conditions. Now many doctors and healthcare workers question why it's a broad brush measure and nothing further is done. Now, of course, it does happen that in some other countries there has been spreading of the epidemic from visitors, but can you give some conditions for relatives to visit? Now, the elderly will pass away if they keep being unable to meet their family members. Now, we have considered all three issues. At the next meeting, we will explore the impact of the pandemic on care for the elderly. We have thought about the visits issue. Now, after the pandemic has stabilized, especially the current wave, we will give a more specific reply. Now, we understand the troubles, the suffering when the elderly are not able to meet their family members. As for testing, we please tell them they don't have to pay over $1,000 for the PCR test. The government has a testing service that charges only up to $240. Now, we understand the impact of the pandemic. At the next meeting, we will provide detailed responses. Now, of course, if you get a bottle, it's free. Now, as Mr. Chang said, will you take a humanitarian approach? Now, you can have the arrangement where there are some kind of gloves where the visitors can put their hands through into the gloves and touch the elderly. Now, will you consider such approaches? We will talk to the industry. Madam Chair, your example is correct. A worker told me, now it's different if you can touch the elderly. It's different from just talking to them over a monitor. Now the Secretary will consider a proposal. Mr. Poon Siu Peng. Thank you, Madam Chair. The insufficient care homes, we know that there are thousands of elderly on the waiting list. Now, the care for the elderly by the government puts its emphasis on community and home care, whereas the care homes, residential homes, are for supplement. Now, how are the resources for community and home cares? Now, as members said, the pandemic is still severe. We don't know when the elderly. Now, fortunately, there is no major outbreak in Hong Kong's residential care homes, and yet it affects the care service in those homes. Now, you encourage the elderly to continue to stay at home. Now, for cleaning and for delivering of meals, etc., have you enhanced your measures? And the document said that the government spent $20 billion to purchase premises and provide 160 welfare measures to have additional 15 day care centers for the elderly with that $20 billion. Now, do you expect that the increase will materialize given the pandemic? And then the technology fund for taking care of rehabilitation and care for the disabled or the elderly. Now, will you apply these scientific advances to meal services and so on? Now, concerning the $20 billion to purchase welfare places and facilities, we will come back to the panel for a report at appropriate time. Now, as for the Innovation and Technology Fund for application in elderly and rehabilitation care, now we know that there are some general technology product exhibition where certain equipment are exhibited. For instance, when the elderly go to toilet or when they get out of bed, there is equipment available for them to rent. Now, this is available for residents in Sha Tin. Right now, we hope to extend that to the rest of the territory. As for care home places, Mr. Chan can supplement. Now, we thank the member for his questions. Right now, the subvented home places, nursing homes, etc., there is a total of 29,000. And then in community, we have daycare centers, we have home care service, enhanced home care. That's about 15,000 places. And then in April this year, in community care, we will increase by 5,000 community care places. As for the lunch services, since December last year, it doesn't just apply to the RCHEs, it applies to the daycare centers and also home care. We have resources for our teams to reach them, so those who stay at home are not overlooked. Now,
how much manpower has been allocated for soft meals? $75 million has been allocated to various NGOs, and they might spend the money on buying ingredients, etc. The total commitment is $75 million. Any follow-up questions? Mr. Yu Si Wing. The paper said that in the year 2020 to 21, the expenditure will be 12.3%, which is 17% up from the previous year. And in 2019 to 20, the increase is 60% compared with the previous year. So in the latest financial year, the expenditure would go up by 17%. And the expenditure is spent on developing residential care places, sport places, as well as community care vouchers. Will the government continue to increase the annual recurrent expenditure to tackle population aging? In the coming years, what is the planned increase every year? Would it be amount to 15 or 17% based on the financial position? Or would the government have a target commitment every year in order to tackle the current shortage of residential places given population aging? Do you have a holistic plan on this? If you can produce the numbers, people would have a clearer picture, and you can send a clearer idea to the community what sort of objectives the government wants to meet. Assuming you have an annual target, let's say a 20% increase in expenditure every year, if you want more elderly people to age in place, is the current level of manpower adequate? Well, assuming the government is willing to spend the money, does it have the manpower? Mr. Michael Tian talked about converting EA2 places to EA1 places. Then is there enough space to provide such places? Because if there's a shortage of residential places, the prices would simply go up, and at the end of the day, the problem is still here. So how do you tackle the issues of manpower and lack of residential places? It's all about your long-term planning and vision. Is there anything in place? Mr. Ho. Thank you very much for the question. In June 2017, we received the Elderly Services Program Plan from the Elderly Commission, and we would carry out the planning in accordance with the ESPP. Residential care is one of the elements, and in order to achieve aging in place, we need other measures as well. And that is why we launched a number of pilot programs recently. In August last year, some programs ended, and we are proceeding with the relevant work. We hope that our elderly people would receive appropriate community or residential care if needed. In terms of the prices of residential care cases, this is dictated in the market. If there is a large demand and a lack of supply, prices would inevitably go up. But we know that there is a certain demand from the public. The RCHD ordinance and RCHE ordinance are being reviewed, and hopefully we can introduce the relevant amendments to LegCo. And hopefully with that done, and through more bought places, and as a result, I hope we can enhance the quantity and quality of elderly care services in Hong Kong. I don't see how the paper paves the direction for the government's work going forward. At least they should produce the estimated manpower and number of residential care places in the next 5 years. your approach is piecemeal and you are simply patching up the inadequacies. If you have a plan, then you should stick to it. If your plan doesn't work, then it could be improved. Does the government have a plan? Thank you very much. Perhaps the chairman could consider including the ESPP on the agenda at the panel. You should first come up with a plan and then we can proceed to a discussion. On the 10th of July 2017, the panel did discuss the Elderly Services Program Plan. It has been 3 years since then. So in terms of the progress of the ESPP, would you brief us on that again, since this is a matter of much interest to members? The clerk would get in touch with you soon to discuss when this item could be tabled. Mr. Yu, any other questions? Next, Mr. Wilson. Thank you. Chairman, like you said, we were briefed on the ESPP on the 10th of July 2017, and it is now 2021. We urge the Labor and Welfare Bureau to conduct a short, medium, and long-term review on the ESPP. The vision is to allow the elderly to age in place, but the approach is rather piecemeal and there is a lack of resources. I hope the Labor and Welfare Bureau would implement that as soon as possible. As of the end of December, there were 37,525 people on the central waiting list waiting for various residential care services. The average waiting time is close to 41 months. Many elderly people simply could not wait for a place. I see that in the paper. There is a plan to increase the number of residential care places, but the target is extremely conservative. The average waiting time is currently 41 months. Does the Bureau have plans to shorten the waiting time for various services? This is a very realistic problem. A waiting time of 41 months is simply ridiculous. There is a very high demand for residential care services. Under Secretary, earlier, the government allocated $20 billion to buy private residential care places. And you said 15 daycare centers for the elderly will be introduced. So for the $20 billion, what is the progress? Are you still going through the administrative procedures? And how much of this money would go towards residential care services? I hope you can provide an update on such arrangement. We often talk about allowing the elderly to age at home, and this is certainly a good idea. For many elderly people discharged from hospitals, the short-term support is simply inadequate. For elderly people discharged from public hospitals, can something be done? And we need to take care of not only patients from medical wards, but also other patients. So these are the views of many elderly people. what could be done to address the needs for elderly services from the public? Is there a current target in terms of waiting time? For elderly care facilities, medium to long-term planning is needed. We had $20 billion for bought places, and we would increase the GFA in public housing projects for elderly facilities, and we also encourage the development of welfare facilities on private lots. The progress is relatively fast over the past year, but things still do not happen overnight. As for the $20 billion allocation, we have completed the consultation, but the details could not be disclosed yet. Once we have results, we will report to the panel. For the third question on discharged patients, I would defer to Mr. Tan. Mr. Tan, please. Under the Community Care Fund, there's a support scheme for discharged elderly patients, and this is run by the SWD. The program received support from the Commission on Poverty, and the program will be extended to September 2023. In the meantime, they will continue to engage a consultant to assess the effectiveness and the interaction with similar programs. 3 members are waiting to speak for the first time. For the second round, we have 1 member. After the 3 members speak for the first time, we will enter the second round. I will allow 2 minutes each for the second round. I received some motions. Hopefully we can deal with the motions by 11:50. Mr. Leung Chi-Chang, thank you. In terms of the community care service enhancements, what you said in paragraph 7 is rather surprising. Home care services have been strengthened by 2,000 service quotas in 2019 and 3,000 service quota under the IHCS FC in 2021. And there are only 6,700 voucher holders. In other words, the number of vouchers went up by 13,360, but the number of voucher holders only went up by a small extent. Does it mean that people were reluctant to use the vouchers given the epidemic? You have 227 recognized service providers, and on average each service unit can serve about 50. And if that's the case, then you would have a lot of RSPs. Would only 50 users be enough for 1 RSP? And what about the sustainability of such RSPs on the long run. I think you need to look at the business side of things. If the service providers cannot stay afloat even with government funding, they would go under, and at the end, the victims will be the elderly.
Secondly, the contract homes for the elderly. Right now, you will add about, if I'm correct, about 3,000 places. Now, for that increase, would you have enough manpower? The Undersecretary. I will ask the Assistant Director to answer the first question. On the second question, I believe we've heard in the community that there is a shortage of manpower in the care homes. We hope that more people will join the service. We don't want to be short-handed, and then we will import labor for that, and then it will have an impact on unemployment here. So we hope that members of the public can understand the opportunities available in the profession and join that profession. Mr. Chen? On paragraph 7, in 2021, the home care places will increase to 13,000 odd places. That's not the voucher places. It's our regular service users. So as for the vouchers, now the voucher holders, that's about 6,700 right now, 200 odd service providers. That's quite satisfactory. And how to let them work more efficiently, we have been considering that. Now, some service providers are subvented organizations, and they are some of them are private rehabilitation operators, and they also get income elsewhere. Next, Mr. Lau Kok Fan. Now, concerning care services for the elderly, I have 3 questions. Now, previously, the LegCo allotted $20 billion for you to purchase places in the private market. There will be 15 daycare centers for the elderly. Right now, the progress seems to be 0. Why is it so difficult? Things are cheaper now. It should be a smoother progress. And then the private sites for welfare use. Now, under that scheme, how much new land is going to be used for building outreach residential care homes? Now, I see a lot of vacant land in the neutral trees. Some are private. Now, we should encourage them to use the sites to build RCHEs. And then whether it's for land or manpower. Now, actually, if you increase the land, you might not have enough manpower. Now, in the mainland, there are a lot of care service personnel. Now, we have been asking whether some residential care service can be provided in the Greater Bay Area. Perhaps we can encourage some Hong Kong care home operators to build homes in the mainland and engage staff there. And then the Labor and Welfare Bureau can purchase places from them, the Undersecretary. Now, for the Greater Bay Area, we have considered that as an additional choice for the elderly. Now, they offer lower costs and more space per resident. Now, some elderly wish to live closer to their children. Now, the policy address mentions this. How's the progress? Now, we are doing the work, and at appropriate time, we will report to members. Now, this is an additional choice for Hong Kong people. This is always being considered. As for making use of private sites, when we receive applications, we will deal with them as quickly as possible. Some are already in the queue. Now, if members have relevant information or if there are interested parties, we will be glad to brief the site holders. How many applications are there? I will inform you later. Now, as for $20 billion, we asked the Assistant Director to answer the question. Mr. Chen, on the $20 billion, Social Welfare Department under the Government Property Agency in 2020, at the end of September and end of December, separately invited owners of non-residential properties in 6 districts to see whether they can let them make use of these sites for welfare use, and we are looking forward to purchasing those sites, some of those sites. Now, we hope to use the public money well. There are government procedures. We have to consider the location and the size. So if you know of properties that can be sold to the government, we will welcome the information. Now, given the current market, the relevant premises should have dropped in price. So the government should try to implement this as soon as possible. Otherwise, after the pandemic, the prices of these sites will increase. Now, as for the Greater Bay Area, we hope the government will follow up closely. As the Undersecretary said, it's an additional choice. They offer more space, lower price. The government can purchase more services per dollar, and this provides better premises for the elderly too. Now, the elderly will consider the cultural differences, or they may have concerns about the healthcare service availability. Now, we hope to take a coordinated approach. Now, the Greater Bay Area, isn't it you that will instigate this? Now, the elderly have their own considerations, such as the convenience for seeing doctors. Now, of course, you have to meet Hong Kong people's needs. Now, Jockey Club in Shaoqing, they offered places in there, but it's so far from Hong Kong. So many were hesitant about that. But you can find closer places from Hong Kong. Are you considering those? Yes. So we will look forward to your accounting to us later. Holden Chow. Now, the document shows that you keep increasing the number of community care places. Now, of course, I welcome that, but the question is manpower. Now you add the places, you pay more. The key issue is manpower, because in the past it's been said that there is a shortage of carers for the elderly. Now, Hong Kong is suffering from the pandemic. Many people have lost their jobs. I don't know whether the administration will consider a suitable arrangement. Now, the care for the elderly is a long-term task. Now, some people are now jobless, so maybe you can provide more training so that those unemployed can consider joining the profession and receive the training at this time. Now, when they are trained, you can offer them allowances. If someone is willing to join and if they are trained, then in the longer term, we will have more manpower. So do you have such plans? Undersecretary? We welcome more Hong Kong people to join the profession. In 2019, we adjusted the salary structure. Now there has been over 10% increase from 15,000 to 17,000 for general care workers. Now, so that's quite attractive. And we are also providing more training for young people joining the profession. We have a scheme for young people to join the care profession. Now, in the retraining board, we arrange for them to be trained and then get a job in the profession. Now, so understand that there is a scheme. Now, perhaps you need more information to answer this. Now, given the pandemic, you talked about the training for young people as carers. How has the reception been? Are there more people joining the training? Now, employment and then training. This arrangement is introduced this year. So for this scheme now in 2021, in 2020, we provided 1,500 training places and we enhanced the scheme. The work hours is slightly reduced and so on. So we have been able to enlist over 380 enrollees. So this is over several years. Now, for the retraining board, the training offer there. Now, I understand that you have increased the number of places for carers. Will they get a salary of 15,000 to 17,000 after they graduate? Now, for the subvented homes, after adjustment, they will get a salary of $70,819 for. So they, in general, there will be 70.4% to 11% increase. Now, for the vocational scheme. Now, when they have attended classes for 1 year, the salary will increase to $17,090.
就第一輪呢，就提問。
That's all for the first round. We now enter the second round. 2 minutes each, please. First up, Mr. Michael Tian. Thank you. One of the questions I asked wasn't addressed by the government for the residential care outreach service provided by NGOs. What is the response from the interim review, and is there any chance it would be made regular? Assistant Director, thank you. For the residential care services support program, it was started in February last year, and it will last till February 2023. So we are still in the early phases of the program, but response has been very positive so far. It mainly targets private homes. Is it likely to be made regular? It's still too early to call. But so far, the sector providers and users have shown very positive response. I will move a motion on how EA2 places could be upgraded to EA1. There are still about 50 homes with EA2 places, and due to inherent constraints, for example, failing to meet the 9.5 square meter per person requirement, I hope as many EA2 places can be converted into EA1, and I will move a motion in a moment. Why do you think there are so many EA2 places apart from environmental constraints? Mr. Tan, please. Thank you very much. In terms of upgrading EA2 places to EA1, we have been in discussions with the trade recently. Some facilities face inherent constraints. And some operators are reluctant to make the change out of business consideration. Mr. Wilson-Orr. The Undersecretary and Assistant Director did not answer my question on the proportion of the $20 billion spent on elderly care homes. Mr. Tan said they would ask the consultant to look at the program again. Would the relevant programs be incorporated into the support scheme for discharge patients from public hospitals? As for the 6 to 8 weeks of services currently provided, can it be extended to 6 months? I hope the government would address members' questions seriously. Undersecretary, can you offer a response or something in writing? We have 15 daycare centers for the elderly. Through the 5% increase in total GFA in suitable public housing projects, as well as the special scheme on privately owned sites for welfare purposes. Well, for the other question, I would defer to Mr. Tan. Thank you. As for support for patients discharged from hospitals under the Community Care Fund, the duration of services provided for discharged patients would be 4 months. For specific elderly persons in need, this could be extended. we looked at the actual usage parameters in the past 2 years before coming up with the decision. Our consultant would compare our program with other support programs for discharged elderly persons. They would then decide whether the program would be incorporated for patients in the medical ward and whether they could be included. The key principle with this scheme is that the HA doctors would exercise professional judgment for elderly persons with problems being taken care of at home. They could be arranged residential care places, and a number of patients who suffered strokes or bone fractures would fall under this category because it's difficult for them to be taken care of at home. Mr. Tan. Since last year, visit services have been suspended at residential care homes, but why are we still seeing outbreaks at care homes? So everyone should be tested for COVID-19. There have been consistent outbreaks. Mr. Ho. At many of the residential care homes, staff had to undergo mandatory testing, and at this latest phase, all full-time and part-time staff have to be tested every 10 days. Where practicable, we hope to step up the testing frequency, and hopefully we can contain the spread of the virus in care homes. Before the elderly patients were discharged, would they be tested? As far as we know, they would provide saliva specimens. Some cases could be detected in this manner. Are you referring to the HA? Can you carry out a test before they are admitted to hospital again? We are now conducting the 6th round of voluntary testing for residents in elderly homes. That would be a good idea because we certainly don't want to see further outbreaks in residential care homes. Mr. Michael Look, 2 minutes. Thank you. Both residential care and community care requires manpower, and given the current state of the economy, many people do not mind changing professions. Would this be an opportunity for the government to provide more services and jobs so your expenditure could achieve double benefits? This would allow the elderly to receive services and to provide jobs to the people. So hopefully the government can provide more service places. In terms of gerund technology, again, there would be double benefits, whatever the investment. Many people want to procure gerund tech products, but the $1 billion INT fund is only for eligible elderly and rehab service units. To facilitate aging in place, the elderly people would need different tools, equipment, or even games. I visited the Gerund Tech fairs for a few straight years, and I saw lots of new technology that are useful. Would the elderly persons be eligible for this fund, and this would also help develop gerund technology in Hong Kong? We have an exhibition hall in a facility already, and hopefully the equipment or products could be rented or used by elderly people in Hong Kong. And through the navigation scheme and other initiatives, we want to encourage more people to join the industry. Under Secretary, the elderly medical or healthcare vouchers can be used to procure various gerontech products, right? This is under the Food and Health Bureau. Mr. Tan, I have no such information on hand. We have two motions to deal with. Michael Tian, Leung Qishang. The first, Mr. Michael Tian, please read out your motion. Since the community elderly assessment services provided by the HA is grossly inadequate, and some people have waited more than 8 years for residential care places, we urge the government to increase the funding allocation and facilitate interdepartmental collaboration so that all care homes can use such service in the current financial year. The bell would be rung for 5 minutes.
記明OK，唔好打鐘啊！我哋唔打鐘啊！我哋用
The bell would not be rung. A show of hands, please. Those in favor, please raise their hands. All right. Michael Tian, Leung Qishang, Wilson Or, Poon Siu Ping, Michael Luk, Vincent Chang, Cheng Chung Tai. Yu Si Wing. The motion is carried unanimously. Second motion by Mr. Leung Qishang. Please read out the motion. In terms of enhancing elderly community and residential care services, the panel urges the government to increase resources and establish short, medium to long-term targets based on the waiting queue for various community care services and actual needs. And in terms of short to mid-term targets, the service quota and manpower for community care services should be enhanced. Waiting time should be shortened. Home cleaning, medical escort, meal delivery, respite services should be provided for grassroots elderly and disabled persons, and to enhance the community living support for the elderly and PWDs. And on the long run, they should address the waiting time for various community services and increase resources. And these include daycare centers for the elderly, integrated home care services, and enhanced home and community care services, home care services for the seriously disabled, etc. And to increase the number of care homes for the elderly and PWDs, as well as service quota in order to reduce waiting time, to implement the changes to the residential care home ordinances to increase the space, the amounts of living space, and enforce the law in a strict manner, increase the number of spot checks, and enhance the manpower at care homes. And number 3, to increase the amounts of resources for recurrent subvented community care services, including extra resources and service allocation, and to expand the regular home care and daycare services. Number 4, to consider incorporating the resources under the pilot scheme for elderly persons discharged from public hospital into the current integrated support program for the discharged elderly patients, and to review the current HA support scheme. This is seconded by Mr. Wilson Or and Mr. Vincent Chang. Do we need a division? Those in favor, please raise their hands. Okay, the support is unanimous. I announce that the motion is carried.
跟住最後一條又係田北辰嘅，請田北辰讀一讀你嘅。
Motion by Michael Tian. Please read the motion. On the gap between the service and manpower for EA1 and EA2 homes. The many homes still at EA2 level. Given this, the panel urges the government to provide a report within 3 months to increase resources to upgrade the EA2 homes to EA1. Division, raising of hands would be sufficient. Those in support, please raise their hands. I announce that the support is unanimous. Michael Tian's motion is passed. Now, in July 2017, there was already a report on care service for the elderly, a long-term plan, and the administration is conducting the study. We hope that this year, in first or second quarters, we can invite the administration to report the progress so that our questions can be answered, and we can also provide more proposals for the administration. And then the other item on our agenda, we invite the administration to enter the chamber, and we thank Mr. Ho and Mr. Chen for attending. Second item of agenda, government public transport fare concession scheme for the elderly and eligible persons with disabilities. Welcome the administration. We invite the Secretary to take us through the document. We have an opening speech, the text of which is being distributed. The consultant company engaged by the company has completed the overall review of this scheme, and the CE in January 2020 announced that the qualifying age will be reduced from 65 to 60 to benefit about 600,000 members of the public. And in November last year, the policy address announced the conditions for the implementation. That is, we must be able to prevent abuse, and the funding would be in the budget of 2021 to 2022. We hope that this can be gradually implemented in the coming financial year. Now, I would like to report the preliminary decisions by the consultants and the recommended timetable for implementation, and that the funding would be included in the coming financial year. Now, the CE in policy address announced the reduction of the qualifying age from 65 to 60. The consultant company has been instructed to provide a plan for that. The consulting company indicated that many in age 60 to 64, they are still socially active, and some of them are still working. So the number of journeys will certainly be more than those who are over 65 as at present. So the cost will be substantial. and the recurrent expenditure by the government will come under pressure. So there's a need to enhance measures to prevent abuse, and there should be consideration for periodical reviews. So the government will accept the consultants' proposals that those 60 to 65 should be registered to use octopus cards that bear their names and photos. That would be a condition. Now, the consultant company says that given population aging and given that there is no means test, so that can give rise to abuse and cause pressure on government's finances. Now, the consultant company says that the abuse mainly results from the fact that some people can purchase anonymous elderly octopus cards without providing ID. So we propose that they must use the IDs to purchase these octopus cards, and so as to reduce this type of abuse. And in law enforcement, we also will adopt strong measures. The Transport Department will ask all the participating operators to check the tickets and to check identities. And we will spell out the penalties, and we will educate the public that they will be, if they abuse the scheme, they will be have to pay for the price difference, and may be prosecuted. And they have to show the IDs to frontline staff, and there should be encouragement to use the tickets for shorter routes, and the government decides to adopt the consultants' proposals. Now, this scheme will be implemented to red minibus and certain local ferry services. Now this can lead to abuse. So the consultant company suggests that there should be enhanced regulation before the red minibuses and the local ferry services to join. Now, the Transport Department will come up with the details of the scheme, and the consultant company says that the Hong Kong Tramway Company will also benefit from the scheme. And now, given that the increase in government expenditure, the consulting company suggests that there should be regular review on the reimbursement of price differences. Now, the government agrees with the proposal. There will be a review every 5 years on the level of subsidy, and after studying the details of the report, the government will take about 13 months to distribute the personalized cards to about 600,000 people who are eligible in the age group of 60 to 64. And after LegCo approval, then the earliest is that by the first quarter of next year, we can make the service available to those in 60 to 64. And the following 2 years, the mandatory use of personalized cards should be extended to those over 65, and the anonymous cards will then be phased out. Now, this will all be incorporated in the budget next year, and the Legislative Council will scrutinize this, and then all the measures will be implemented in an orderly manner. I have begun to receive some motions concerning this topic. If there are further motions, please submit them before 12:35 to the Secretariat. There are now 9 members who have pressed the buttons to speak. Hong Xiu-ping, Chen Chi-cheng, Leung Chi-cheng, Chao Holden Chow, etc. First, Mr. Vincent Cheng, 4 minutes each, please. The Secretary has spelled out a rather detailed scheme. This is a first step, but it's not totally satisfactory. You mentioned the timetable. You said that the Transport Department and then will study the matter together with the Octopus Company, and it will only be the first quarter of 2022, so it will be over a year before the scheme is implemented. Now, this is 2 years since the policy has been announced, so those in the 60 to 64 fail to understand why it takes so long. Now, the Octopus cards for the elderly, they are nothing new. Why is it that it will take over a year before this can finally be implemented? Now, for personalized Octopus cards, they are already in use. Why is it that it will take so long? Secretary, we know that personalized Octopus cards have been in use for years. I have one myself. So far, we have approved about 400,000 such cards. Now, within a short time, we have to issue 600,000 new cards, all bearing photos with a specific design. And this will take time for the cards to be issued because only 400,000 have been issued so far. So in terms of hardware, software, and manpower to deal with the 600,000 cards new issue, and also it will take software as well as hardware enhancements, so it will take a little over a year. This is our best effort. Now, to apply for personalized cards, this is not very convenient right now. There are a few places where people can apply. In the past, there have been no particular reasons for people to apply for those cards. But now this is going to be mandatory. So there will be a strong demand for manpower and resources. Now, we have allowed 13 months for issue for those in 60 to 64. Now, this is hard to accept. Now, you're talking about first quarter of 2022 before the elderly can apply. Can we accept that? Can it be earlier? Now, you talked about the technical measures. Now, it's difficult to understand. What are the technical issues involved that it will take over a year before people can apply? Please don't misunderstand. It's the time that people can actually use, not the time for them to start to apply. We hope now we want to allow everyone who is qualified to be able to use the cards at the same time. So you said in the first quarter, now those aged 60 to 64, So you mean that they can start to apply in the middle of this year? Yes.
重泰。
Next, Dr. Cheng Yong-tai. Thank you. I have 3 questions. There were reports earlier, and the government also indicated that for those aged 60 to 64, the $2 scheme would cover some people who are still working. At the same time, some people are concerned that with this scheme in place, traffic congestion would become more serious during the peak hours. And as a result, in terms of the consultancy study, such the idea of suspending the $2 scheme during those peak hours has been floated. So are there such plans, or indeed does the government believe that the $2 scheme would not exacerbate the traffic congestion? The second question is related to Mr. Cheng's question. In the Secretary's speech, I see that for the $2 scheme arrangement for those age 65 or above, would the use of a personalized octopus card be required? And the Secretary said that in the next 2 years, the requirement to use the personalized octopus card would be expanded to the 1.32 million elderly citizens aged 65 or above. There are some 3.6 million anonymous elderly octopus cards in the market. And we have some 1.32 million elderly population age 65 or above. So is there a possible abuse? And you are going to limit the $2 concession to those using the personalized octopus card. So after the year 2023, are you going to suspend the $2 concession from the anonymous elderly octopus cards, or would this be implemented in phases? The Secretary talked about the time needed for application and registration. There are 3.6 million anonymous elderly octopus cards and about 0.4 million personalized octopus cards, and you don't know whether there would be any overlaps. What is the implementation timeline for the 2 years? Or in 2023, are you going to say that you would remove the $2 concession from all anonymous octopus cards? Secretary? Like I said before, we would assess the usage patterns during peak and non-peak hours. In terms of the usage of public transport modes among the elderly, the patterns are very different compared with people who go to work. So the peak of their usage do not coincide with the typical rush hours. And that is why we would not restrict the use of such concession to certain hours. For the age bracket 60 to 64, about 47% still go to work. So we would not be imposing any restrictions in terms of implementation timeline. By 2022, we would mandate the use of personalized octopus cards for the 60 to 64 age bracket. And after 2024, anonymous octopus cards will no longer be in use. We have 1.32 elderly persons aged 65 or above, and we have 400,000 personalized octopus cards. And in other words, about 900,000 do not have a personalized card. In 6 to 9 months, we hope to distribute all the remaining cards, and 2 years would be adequate to issue the remaining 900,000 cards. By 2024, many people would have had a personalized octopus card already, so we will be issuing less than 900,000 cards, and we will cancel the anonymous cards. Mr. Woods and all. Lowering the age limit from 65 to 60 for the public, this has been much anticipated. There is great anticipation for the $2 scheme and to lower the eligible age, and the implementation timeline is equally important. Secretary, we have to wait till the first quarter of 2022 at the earliest for phase implementation. In terms of the efforts of different departments and your discussion with the octopus company, is there any way the process can be sped up? I hope you can have a discussion with your team, or indeed you should urge them to speed up the process. You discovered abuse since 2019. There is an elderly population of 1.32 million, and there are about 3.6 million anonymous octopus cards. Why hasn't the government taken out decisive action to fight such abuse? I asked about the unemployment assistance earlier. You said there would be abuse, and that's why you would not do anything. You must step up publicity, step up the punishments as well as enforcement. Hong Kong people are law-abiding. I am sure that they won't take their chances. So is there any way you can enhance your work? Secretary, you said a review would be conducted every 5 years. On what basis did you draw such line? Why don't you make it 3 years or 4 years? Secretary, Chairman, we will certainly do our best in speeding up the process as much as possible. We will speed up the work process with the octopus company and various operators. The bulk of the work is not carried out by the government. But if the work is conducted by the government, it might take even longer than 30 months. In terms of preventing abuse, the source of the main reason for the abuse lies with the anonymous octopus cards. If we lower the age limit from 65 to 60, the concern would be even greater because they don't look very different. So the burden created on those responsible for monitoring would be even heavier. If we don't tackle the issue of personalized octopus cards, then it would be hard to find a way back. While lowering the age limit, we would promote the use of personalized octopus cards as well. Fares would consistently go up, let's say, by 5%, and our allocation would increase by more than 5%. We are conducting a review every 5 years because if we slightly adjust the fares every single year, it would be really troublesome for passengers. So we find it appropriate to conduct a review every 5 years. Since the work is borne by operators, we hope they could be put in place by mid-2021 at the earliest, and I will propose a motion in a moment. For the 4 million odd elderly octopus cards, including anonymous and personalized cards, what is the annual payment from the government to the octopus company? The government has no role. What is the annual payment to the MTR company, MTR Corporation? $1.3 billion in the current financial year. Yes. But this is not for the octopus cards. So the annual payment is about 1.3 million. So the government has to subsidize the 4 million elderly octopus cards. The subsidy is for the elderly persons and persons with disabilities. Mr. Poon Siu Ping. Many people applauded the $2 scheme, and the goal is to build a caring and inclusive society. We have some 1.3 million elderly persons, and on average, each person has 3 or 4 octopus cards, and the government might see this as an abuse. For the suspected abuse cases, there were about 100 per year, but very few were prosecuted. When you look at the mainland government, free fares are provided for the elderly people in the Bay Area, and the consultant has a regular review mechanism. And in 5 years, you would review the subsidy amount that is currently $2. I'd like to know what the mechanism proposed by the consultant entails. You are about to issue personalized octopus cards, and it would take 3 or 4 years. I hope the government can speed up the work. With the personalized octopus cards, you can prevent abuse. For the new old, they might still be working. If they pass on their personalized cards to someone else, what would be the penalties, Secretary? Chairman, for the so-called 5-year review, in 2012, the concession scheme was introduced, and since 2019, we have been conducting a review, so it has been more than 7 years. So the subsequent 5-year reviews would be appropriate. As for the $2 concession level, once the fares go up and the subsidy level remains the same, well, the $2 scheme might be renamed later if necessary. So this is important to the long-term financial commitment.
Now on the time matter, now to issue the cards, as I answered Mr. Vincent Chang, right now there are only 400,000 personalized octopus cards. So that's over all these years. So within a short time, we have to issue the new ones. So it's a pressure. So many software, hardware, and manpower improvements have to be effected. So that's our main consideration. Now on the penalties, the abuser will be penalized. We don't penalize the card owner. Now, given the time constraint, there are 6 more members who wish to speak. Then I have to deal with several motions. So I announce that the meeting will be extended by 15 minutes if necessary. Now I will allow 4 minutes each. If there are more members, when you press the button, and if you haven't spoken, I will give you 1 minute. Michael Tian. Now on 12th July in the Financial Affairs panel, I asked the Financial Secretary. Now the fee concession is $2, but the fares keep rising, so it's a heavy financial burden. So I suggest that you adjust the $2 level every 5 years. Now you accept the consultant's proposal, so I support this aspect. It's very simple. You just peg to the overall transport fare level. Now there are 4 aspects. Now changing the software for Octopus card, changing the hardware for transport sector. We amend the legislation. We allow the funding. Then people have to apply for personalized cards. Now, to change the software, that will take 3 months. They've answered that several times. For the transport sector to change the hardware, bus companies and the MTR, CL, they say 3 months okay. Amending the legislation, I think that will be okay in 6 months. And then the funding can go ahead at the same time. So within the current session of LegCo, that is before July, I believe this can be implemented. I agree with the Secretary. For the 600,000 people to apply for personalized cards, this might not be accomplished within the 6 months. Now they have none, so it's totally new. So we can set the conditions. So in July, all the toll gates have been updated. And when these people apply in the 60 to 64 age group, they can be charged $2, and otherwise, if they break the law, they will be penalized. Now, so if the 600,000 apply quickly, then they will benefit. So what's wrong with this line of thinking? Now, there are some software adjustments in particular. For the personalized Octopus card is a piece of hardware. Before this is issued, we have to ensure that it is coordinated with the software. Because if we issue the cards and then we have to amend the software, then it will be a big problem. So you have to be certain up to a certain level before you can issue the cards. So the system design can start early, but at the point, but it takes almost half a year before the cards can start to be issued. So that's why I said that the issue of cards will take 6 to 7 months. Now, if we issue the cards right at the beginning and let people use it right away, it will be very confusing. 600,000 people will queue up for the cards, so you can imagine the picture. Now, even for vaccinations, it will take several months. The appointments have to be made. So I think if you let people expect to get the cards the first day, it will be difficult. For those who are 60 to 64, if someone applies for a personalized card, now if the card hasn't yet been implemented, when he uses the card, he has to pay the regular fare. Now, when the toll gates have been updated, then on that date, he can be charged $2. You say that can be done? Once the card is issued, okay. Now, our current system, the design, etc., are not yet determined. Now, once we have decided on it, then we will go ahead with the design. My question is, if you apply, if you have a personalized Octopus card now, I believe later you will have to change to a new one. You see, Wing? The $2 card is a beneficial policy. It will save the elderly people money, and they will let the elderly travel around, so that will reduce social problems. So the government is being positive, but the problem is considerable. Now, so there has been a lot of abuse. Now 400,000 cards are used, but there are only over 1 million people qualified. Now there have been checking, but the deterrence has been low. So the government's expenditure has increased 5 times. So we need to take the right measures. Otherwise, there will be hundreds of millions of dollars increase in public expenditure each year. Now, for those who are over 65, we have the information, we have the personalized cards. So perhaps starting now, you have a requirement where those 65 will change to the personalized cards right now. So at least you take care of this batch. Now, so you have a few years head start. So is it possible that this year, since we already have the software, then you go ahead, encourage people to change to personalized cards with photos? And then on prosecution and checking of tickets, can you ask the departments to step up inspections and checking? Now, it looks good. Only several hundred people are penalized. So more and more people will be encouraged to use the cards unlawfully. So you should increase the penalties. You should make it even subject to a prison term. Now, if we start with those over 65, then it will be 2 years before we can handle those 60 to 64. So we certainly deal with the 60 to 64 age group first, because we would like to offer the concession to those in the 60 to 64 first. Now, if we change the order, then everyone will have to wait till 2024 before those 60 to 64 can make use of the concession. So we start with the 60 to 64 age group, then by 2024, everyone can be in the scheme who is over 60. Now, to step up inspections, that means engaging more manpower, so you have to pay for that. So it's not just increasing inspections now. If I just go and do it for one day, it's not much help. Next, Leung Chi Cheung, Madam Chair, the Secretary said that for the 60 to 64 age group to enjoy the concession, people would have to wait a long time. But at least the Secretary is right in tackling the 60 to 64 age group first. Now, Hong Kong is now worse and worse, getting worse and worse in its efficiency. Now, we are approaching a third world country. Now, of course, you don't do it yourself. You get a consultant company, you get an IT company. But is it that the octopus company that incompetent? Now, also over 1 million passengers. It will take over a year, and for the 60 to 64 age group, it won't be till the middle of next year. I can't accept that. There are many payment systems in Hong Kong. It's not just Octopus card. Now, is it only Octopus that can handle this? Now, of course, the Secretary will say the buses and minibuses and ferries, they have no other payment system other than Octopus card. But as I know, in other places, especially in the mainland, it's not just Octopus card that's available. They have Weixin Pay, Alipay. Now that can be used to make payments. No, why can't you think of other payment systems? Maybe they can get ready for in a couple of months. Now Alipay and Weixin Pay, they are now in the actual names of the holders. Now it's easy to tell that you are if you use the payment system unlawfully, because it's easy to check the age. Now, Mr. U.C. Wing says that more inspections will be effective because if people are caught, they will have to go to jail.
Secretary, in the consultancy study, apart from looking at payment systems, apart from the octopus, they would also look at other possible payment systems, regardless of the $2 scheme. In the public transport market, there are choices to be made by users and operators. In the government's perspective, a system that is not anonymous would be adequate. The use of the octopus is more user-friendly That is, people could simply apply for a card. For other payment systems, they could be challenging to the elderly. We have been using the Octopus card since it's been in use for many years, and in most cases, there won't be issues with the elderly using the service. Some people could say that filling out a form to apply for a personalized Octopus card would be difficult, but the same can be said for other payment systems as well. So staying with a payment system that is familiar with most elderly people would be appropriate. Mr. Michael Low. For those above the age of 60, they are what we call the new old, and we hope they can enjoy the $2 scheme. The government promised last year to extend the scheme. But this is a prime example that the government's approach leaves a lot to be desired. They should really speed up the work. The government should learn their lesson. This is something much anticipated, but they have to wait more than 2 years. They would have to wait till the first quarter of next year. Even though having a timetable is better than none, there's still room for improvement. In the application of the 600,000 personalized elderly Octopus cards for those aged 60 to 65, very often people would leave things till the very last minute. And we will see long queues and heavy congestion. And some people might fail to apply for the card. Is there any way the government could encourage people to apply for a personalized Octopus card within the next year? Secretary, time is needed to work on hardware and software adjustments and upgrades. Once we are near completion, we will start accepting applications for specified personalized Octopus cards. So the distribution will be completed in 6 or 7 months. We hope the preparation would be ready before we accept applications, but for the age bracket 60 to 64, it would be hard to carry out the implementation in phases like the Hong Kong Identity Card. But nonetheless, we will see how we can smooth out the process. Our goal is to provide enough capacity to handle such applications. The government said there are concerns about possible abuse, especially if the age limit is lowered to 60. Would you allocate extra manpower for ticket inspection duties in the 3 years 2017 to 19? The number of suspected abuse cases were 143, 185, and 11. Why were there so few cases in 2019? Was it due to the social turbulence and black-clad violence, which led to difficulties in enforcement? Or is it because of people who jumped the gates? Very often those are not elderly people. Why were there so few cases of abuse in 2019? In 2019, in the second half, the number of commuters went down, and there were obstacles in law enforcement as well. Mr. Oden Chow, thank you. Members have followed up on the $2 scheme for a very long time. Like Mr. Leung Chi Chung said, Would you consider other payment systems? And are there other ways that could be considered? So the quicker we can get it done, the better. This has dragged on for a very long time. We have to wait till Q1 of next year. You are making the switch to personalized octopus cards. For the cases of abuse you cited, they must be minimized. So in terms of the MTR Corporation, well, they are the main stakeholder. Are they obliged to step up ticket inspection and preventing abuse? If they do their job, then the abuse could be minimized. That way, you won't have to use so much time and effort to adjust your system. Of course, late is better than never. Since a lot of people ask about adjustments to the $2 scheme, but this has dragged on year after year. So in terms of securing more manpower for inspection and tackling abuse, then you won't need to spend so much effort adjusting your systems. Is this something you have considered? Secretary, Chairman? Well, we can inspect every single user. We have about 1 million passenger trips every year under the $2 scheme, so you can imagine the level of manpower that would be needed. If you ask the operators to step up their manpower, then it's not out of the equation, but that could be reflected in the fares, because ticket inspection requires manpower, so it's about striking a balance. It's about achieving a certain deterrent effect. The mode of operation of different public transport modes are different, so the approach to inspection would be different. The personalized octopus card can make the process of inspection or verification easier. It would be hard to mistakenly use other people's octopus cards. That would not be convincing. Ticket inspections could affect the commuting times of all passengers, so it is important to strike the right balance. Finally, Mr. Kwai Kang, after he speaks, we will vote on the motion. Mr. Kwok, thank you. Thank you, Secretary. In terms of fighting abuse, no one would object to it. The number of people caught and prosecutions made were relatively low. It's about whether the transport operators are obliged to do it, because the government would be the ones suffering losses. I think we all know about this reality. The switch to personalized octopus cards is inevitable. In early 2020, when the government proposed the 10 livelihood initiatives, the epidemic was yet to arrive. And now, given the epidemic, government revenue has been affected. Many people look forward to more work from the government because of the poor shape of the economy. some of the young old used to have a part-time job, but now they are out of a job. So they need to save up in whatever way they can. So the $2 concession scheme is certainly very helpful to both the public and the economy. So hopefully this can be achieved by the first quarter of the year. Before the $2 scheme was in place, many people living on the island would choose to take the tram. And with the $2 scheme, the tram company lost a lot of elderly passengers, especially those between 60 to 64. And this in turn jeopardized the tram company. It funds more than 600 families, even though it's foreignly funded. It provides a lot of jobs, and it is a mode of transportation that must be preserved in Hong Kong. If we provide free trips for PWDs and the elderly, the cost would be some $1 million per month. And inflation would not make a substantial difference. The paper said the relationship between tram service and the $2 scheme would be studied. Currently, elderly people only pay less than $2 for a tram trip. Are you putting the tram company under jeopardy since the elderly passengers are now taking the bus instead? For the details, we would negotiate with the tram company. But the principle is that we would use the no worse off principle. That is, elderly passengers would not pay more by taking part in the $2 scheme. Any follow-up questions? Well, of course, but it's about balancing the appeal of different modes of public transport. If the difference between a tram trip and other trips is so little, people would still choose to take the bus. We are going to deal with two motions. The first by Mr. Michael Tian. Please read out the motion. In January last year, the government announced that the eligible age for the fare concession scheme would be lowered to 60, but it has yet to be implemented. The panel urges the government to inform the Octopus Company to modify the software within the week and instruct transport operators to update their turnstiles or fare machines, and that the policy should be implemented as soon as possible. Those in favor, please raise their hands. The support is unanimous. The motion is carried. The second motion is by Mr. Wilson Orr. This is a joint motion moved by myself as well as Mr. Len Chi-Chang and Mr. Vincent Chang. We urge the government to implement the $2 scheme for the age bracket 60 to 65, including starting the application and registration procedures within the quarter, so that after after the budget funding, the program could be implemented in the middle of the year. And in light of the abuse of elderly octopus cards, we propose the government to prevent abuse through administrative procedures and enhancement. Those in favor, please raise their hands. The support is unanimous and the motion is carried. We have no other business today. The meeting is adjourned. Thank you very much.